Some of you have some questions, and I'm just going to take a quick brief here.
No problem.
Any questions that you have? Okay, yes.
And make sure you wait for us to bring a microphone to you.
Okay. Go ahead. Go ahead.
If you have chronic pain and you take CBD, have you had any experience either in the literature or of your patients of side effects?
Side effects. Okay.
Effects of CBD.
Yeah, CBD, minimal risk of side effects, usually not untoward side effects, but in higher doses it can be quite sedating. That's not all bad if you're having trouble sleeping. Sometimes if you're trying to function during the day, it can be a little bit in the way to be sedating. The biggest concern with CBD is liver metabolism. The cytochrome P450 system in the liver is responsible for metabolizing about 60% of pharmaceuticals on the market, and it's also directly affected by CBD. That's part of what we do. We've got to look at possible medication interactions. Maybe have to adjust dosages and stuff.
Yeah, both CBD, THC, all cannabinoids, they are metabolized by the cytochrome P450 system. THC is an inducer of some cytochrome P450 enzymes that break down other drugs, while CBD is an inhibitor. So if you're taking hard doses of CBD, then it's going to preferentially or block the breakdown of other drugs. The drugs that we are most concerned about are things like warfarin, Coumadin, or anti-epileptic drugs. But clinically and scientifically, so in literature, we actually don't see the increase in those medications surpassing their therapeutic index, meaning that they don't hang around to toxic levels before eventually getting metabolized. So, I guess the best case scenario, we're decreasing the prescription drugs you're on anyways when we're using, cannabis and cannabinoid-based therapies, right? If it's not getting broken down and you have higher levels in your system, well, we can come down off that drug, right, as we increase those cannabinoids.
People look at CBD, they say, oh, it's not psychoactive. And we say, well, yes, it is psychoactive. That's why it works on seizures, it works on anxiety, depression, PTSD. It is working on your brain. It's not intoxicating like THC. And when you look at the intoxicating effects of THC, it would be your altered perception, time perception, slowed responses, short-term memory problems. Those are all intoxicating effects that the THC has that CBD does not.
All cannabinoids are psychoactive.
Yeah.
But the other note, very high doses of CBD can cause some nausea, upset stomach. But I think it's 200 milligrams per kilogram of body weight a day is what an average human being can tolerate. Nobody's taking that amount. So it's a lot of CBD.
Just a visit to the American Cannabis Clinic. Do most health insurance cover that?
So one thing, we do not deal directly with insurance because as soon as you have cannabis anywhere in your forms, they don't allow it. But we can generate a super bill that then you can submit to your insurance company under ICD code, basically as an office visit or consultation.
If a patient has, for example, non-small cell lung cancer metastasized to the liver or another cancer in the liver, what are the ramifications of using cannabis?
Ramifications?
Yeah, is there any effect?
What's the benefit?
Well, I'm just wondering from a personal experience.
Absolutely, I'm just playing on the facts, which are that cannabis, and this is in studies, this is in the literature, actually works with chemotherapy, with radiation to improve outcomes. So what we've actually seen is that cannabis plus conventional therapies are better than either one alone. And we do have enough evidence to suggest that cannabis is more effective than chemotherapy and radiation therapy.
I wish we had known that in 2010.
Yeah, but it's interesting because, the information has been out there.
That's the frustrating part.
We had a 5-month-old come in with a neuroblastoma, and you start doing the literature research and things. They've shown CBD in particular very effective in killing cancer cells and gliomas and brain tumors, and this is like 2005 study. I mean, what have they done to advance it since then? I mean, any other conventional medication, in 2 years, this would be, state of the art because it helps. We can't say it cures, but when you see, case after case where the size of the tumor is reduced, when you bring the cannabis into the picture, it's just astounding.
We've seen the gamut. I think we've had patients elect to go cannabis only or natural only. So yes, diet and lifestyle is very important. We talk about those things too. But cannabis monotherapy, and I won't say cure, push breast cancer into remission, right, without pursuing conventional methods. We have a patient right now who has very aggressive tumor types, and a young guy, very, very, very aggressive. His tumors are just growing and growing and growing. Well, they've stopped growing on cannabis. We haven't seen a reduction in those cancers, but this is a guy who was told he only had 3 months to live because his tumors were growing that quickly. And he's maintained the same size of tumors for, 6 months now. And he's on conventional therapies along with that. So we've seen it all.
Yeah. What's interesting about cancer cells is that some of these receptors we talked about, there'll be abnormal expression of these receptors on the cell membranes, and so they can be a real target for those cannabinoids
On the cancer membranes.
on the cancer cell. And so it seems like cannabis really attack those cancer cells preferentially because normal cells don't have that upregulation of those receptors. And the things that it does. I mean, we talk about programmed cell death or apoptosis. Every cell in the body it divides to a point, and then it won't divide anymore. It'll die, replaced by other cells. But in cancer, it just keeps growing. They don't have programmed cell death. So cannabis works by bringing back apoptosis. Promotes the programmed cell death in those cancer cells. They stop growing. Prevents them from invading neighboring tissues. Helps prevent metastasis. So there's so many ways that the cannabis helps with that. I guess back to liver metabolism. If you got metastasis to the liver, I mean, you always worry, what's the function of that liver? You have elevated liver enzymes and things. So that's where you do have to be a little cautious with dosages and things, so you don't precipitate more problems that way.
In the interaction between CBD and warfarin, which direction is the effect on the warfarin?
Increases serum or blood concentrations.
It
of warfarin.
increases what?
The concentration of warfarin.
Yeah. So potentially would increase your INR, above therapeutic
Yes.
range.
Good.
But again, in practice, I don't think I've had a patient who's had their INR affected by their cannabis.
That's not a contraindication. It's just a matter, okay, you've been getting your blood tested every month. Well, if you start it, maybe you should get it tested every couple of weeks and make sure it's not trending up. But usually what we see is that it may be a little higher, but still in the therapeutic range.
The question really is, if I'm taking CBD, I eat more spinach or less spinach?
When a new patient comes to you, I know you're refreshingly scientific, very good. So I assume you gather all sorts of data about their condition, their medical history, and all that. But what is the general procedure? Do you do a battery of tests to find out the chemical concentrations of CBD or THC in their blood or whatever? What goes on? What could we expect?
Very interesting. Stanford does claim to have a test of endocannabinoid tone. So they're able to test the levels of anandamide, which is one of our endogenous cannabinoids that we make at any given time. But no, we want all the data on you. everything, especially if you have a cancer, we want to know the tissue type. We want the biopsy results. We want to know everything about you. But we work in concert with your regular doctor too, so we're not ordering a lot of tests.
Yeah. Typically,
we're monitoring the same tests that they're running on.
Yeah, we're pretty reliant on folks having, we're consultants basically, you know. We'll bring that information to it, we'll analyze it. I mean, there's some patients we may want to, you know, say, oh, you should have this additional test, but for the most part, those things are being done. You know, you're seeing an oncologist, you got all your, you know, biopsy results and that type of thing. So we just basically review it, review the medication, you know, and then kind of, you know, try to, you know, help guide you through how you can initiate the use of cannabis and other, you know, things that could contribute to managing your condition.
A lot of our care is designed based on a patient's need. We might have somebody that you know, has a minor or a less complex problem. We just need to address their cannabis therapeutics. Then we have patients who really require all hands on deck. We design protocols for those patients, and we go get into detoxification, nutrition, activity or exercise, endocannabinoid tone. We talk about spirituality, we talk about mindfulness, all those things. Because our practice is based in lifestyle / functional medicine. So our job is to really study you, try to uncover the root cause of the process at hand, but also use therapeutic modalities like cannabis to either treat or help your body treat that condition.
Okay, so my guess is that most people, taking a guess here, are interested in terms of less serious kinds of issues, and using cannabis for pain, the kinds that seniors will have, a variety of different pain problems, whether it's arthritis, those kinds of things. And it seems that the challenge is how to figure out what to buy, what to try. It seems that, just like actually with other medications also, the individuality of people's responses is going to make that very challenging for most of us to go try to find some cannabis product that would help knees, headaches, nausea, whatever it is.
Yeah.
You have some ideas or suggestions on that?
Our job is to improve the precision, right? Because people have been using cannabis for decades. I mean, we showed you centuries, but decades throughout prohibition for their various conditions. I mean, for the most part, people have been throwing cannabis at the wall when it landed somewhere near the bullseye. And even if it doesn't, people get relief. I mean, one of the most common effects that our patients tell us it's having on them is improving their quality of life. I mean, I've had patients say, look, it actually doesn't improve my pain, but it dulls my perception of pain. And I'm like, isn't it the same thing? But they say it's different, but they say, but I can function, I can move, I can play with my children, you know, I can go grocery shopping, I couldn't do those things before. So generally speaking, people can find sort of a broad, non-specific benefit from cannabis. Our job is to help make it more precise.
Well, a lot of things that could go into that. I mean, everybody's endocannabinoid system is different, all right? So there's no standard dose. You come in, you got high blood pressure, I'm going to prescribe you lisinopril 5 milligrams. Okay, months later, oh, it's not really good. I'm going to make it 10 milligrams. Okay, I mean, it's a very simplistic approach. You know, well, cannabis is not that easy, and some people think, well, that's kind of why it fell out of favor, because you know everybody's response is so different.
Yeah, I always counter that it is that easy, because you guys, most of our drugs that we prescribe you, we prescribe off-label anyways. They have not been tested for the condition that we're using them to treat. We just start at low doses, right? Yeah. 10 milligrams on lisinopril, and we increase it from there. Like, we do the same thing in cannabis medicine.
So here
there are
we're
no
not talking about just dose, though. It's kind of CBD-THC ratio, your, you know, other, you know, terpenes and everything's in there. I mean, so there's a lot more variables to work with. But again, it's just still a matter of titration till you find what we hope is going to be that minimal effective dose, and you get you there.
It's the same pragmatic approach that you go through with your clinicians. You increase doses slowly. If it doesn't work, they switch to a different drug.
I have two questions. One is are cannabinoids effective for high blood pressure that standard medication doesn't seem to reach. And the other question is, what about recreational use as an alternative to alcohol? I've been told, cut down on your alcohol.
Lots of them out there.
And
The second one
I
is.
safely use or effectively use cannabis to round off the world in the evening.
Yeah, so cannabinoids can dilate blood vessels, which improves the flow through those blood vessels. It can lower blood pressure over time. So a lot of our patients do come off of or reduce or come off of their antihypertensive agents. Yes, that is possible. Our theory on recreational cannabis is that it doesn't really exist. Most people are reaching for cannabis because it helps them in one way or another. Like, dare I define what that way is? And in most cases, it is therapeutic, right? If I just want to relax at the end of my day, I don't have no reason for using it. This is what people say, but I like to relax. I would argue that that is a therapeutic use and benefit. I think a lot of people use it and don't realize that it is improving their PTSD or something else that they're dealing with, or IBS. I have a lot of young people with IBS who recreate with cannabis because it helps them. So I would argue we don't really have a recreational use. I think people are getting, it's the endocannabinoid system, folks. What your intent might be to recreate or medicate, but it's still working therapeutically in the same way. However, you can misuse it, you can abuse it, you can overdo it, and there are consequences to those things. I think for me, when I'm thinking about recreating, bordering on abuse, I'm wondering what is that person going through that they're reaching for cannabis to cover up? The same way they might reach for alcohol to dull away whatever their issue is. So
A lot of people, they'll look for alcohol, just to relax or get a little uninhibited, have a good time, so cannabis can do the same. Anheuser-Busch is one of the biggest contributors to anti-cannabis campaigns. They're going to lose market share.
well, they already do. So in states that have legalized, we've already seen a significant reduction in alcohol sales. We've also seen a significant reduction in
I have a
prescription
question. I would be interested in cannabis for osteoarthritis pain. So I have a doctor at OHSU. I go to my doctor and say, hey, I want to start, I have tried several things. I do have massage, I do have acupuncture, you name it, the different things, and has sometimes worked better or worse, depending. Or would I be better off going to your clinic or something? Is there actually a clinic in Oregon?
Mm-hmm.
Here in Portland?
Mm-hmm. Yeah.
Okay. Well, what would be my approach? Would be more effective.
So you just described what unfortunately we call alternative medicine, which is crazy because alternative would suggest that conventional medicine is the alternative. Right? Right.
Yeah.
But all of those things work on the endocannabinoid system. I don't mean to get sort of too esoteric or anything, but I have a friend, and this is sort of a tangent, I have a friend who just finished her thesis in Chinese medicine, so now she's a Chinese medicine doctor, and she asked me, I met her because she asked me to be a reader on her thesis, and it was comparing ancient Chinese medicine to the endocannabinoid system. And I asked her, after reading it, did you realize that you might be describing the first biomedical model to finally explain how Chinese medicine worked? It was like this. It was beautiful. And we talk all the time, we had a very brief picture of sort of the human body and the receptors. Well, where we put acupuncture is on all those meridians of the endocannabinoid system. So the things that you're already doing, the acupuncture, the massage, all of those things are actually working on the endocannabinoid system and modulating that system so it works better. So cannabis would, in my opinion, just be a complement to what you're already doing. I wouldn't say it's an or, I would say it's an and.
Yeah, no, I agree. It would be a combination of things.
Yeah.
I think you know exactly what works. But I was wondering, what's the approach? I haven't tried it yet because we were only recently in Oregon. To approach him and say, would you prescribe it, or would you send me, or who should I contact, the information?
All those questions are good ones.
Yeah.
Okay.
Yeah.
We have That's what I would ask.
I mean, they've had studies showing, CBD is even more anti-inflammatory than ibuprofen and your other non-steroidal anti-inflammatories, which are mainstay in treating, arthritis. And those things. So I would say, hey, you get as much anti-inflammatory without keeping the GI docs in business scoping you for your GI bleeding. So it works on the inflammation, and certainly works on the pain into things too. Helps kind of moderate those peripheral nerves as well as your brain's perception.
Question here.
Well, you may have just answered my question. I was going to ask you for arthritic pain control, which a lot of us have. Is CBD better than THC, or both of them together better than one or the other?
Just about every condition does better with a combination. We haven't gotten into that, what they call the entourage effect. If you look at the studies that have been done, for example, CBD isolate, and GW Pharmaceuticals has done this with Epidiolex. And you look at your graph, the dose and your response. When you have an isolate like with CBD, you get a big spike like this, right? You increase that dosage to the point you get some effect, you go too far, and you lose all that effect. So it's kind of a narrow window. When you put CBD in a whole plant, full extract as we call it, you get a bell curve that's much wider. So that people are getting benefit from here to here rather than in this little narrow window. So again, for pain relief, some folks do real well with just with CBD alone because it is so anti-inflammatory, helps moderate those pain receptors. Some people with bad pain or neuropathic pain, it by itself is not as effective. You add some THC to it, and they get much better pain relief. And again, we're not even getting into all the other minor cannabinoids and the terpenes that can have a big difference too. Beta-caryophyllene, black pepper terpene. It's one of the most anti-inflammatory terpenes there are. So, there's so many of those things can add in to give you that relief.
And I'm just going to weigh in. I've got both my hands are very arthritic, and 6 months ago I could hardly hold a pen in both hands. I've been using a lot of CBD topical recently, and my hands are coming back, and I started watercoloring again this week. So it's patience again, and again I'm a huge proponent for CBD topicals.
Hi. Love this whole discussion. I see no controls, and maybe I missed something, but I see no controls over who should be using any kind of marijuana and who should not be. It seems like anybody could just walk into a store and say, I'd like some recreational, marijuana, and it might be the worst thing they could do, even for physical reasons that you're talking about. There don't seem to be any controls that way. That bothers me. And also, I'm worried about a side effect that I read about not too long ago, dementia. That over a period of time, marijuana can, slow down the old brain, which is already slowed enough, at least in my case.
Well, so OLCC is supposed to be regulating the adult use market. So they're supposed to be controlling who can and cannot enter adult use shops and buy product. So that's on them. I can't speak for them. Medically speaking, we believe everybody should be on some form of cannabis. Everybody. Everybody.
And
Babies
again, we're looking
to
at
the very, very elderly.
Yeah.
Everybody.
They have lots of studies that show people with Alzheimer's often do much better on cannabis as far as their daily functioning, ability to respond and concentrate. But yeah, there's certainly the studies that have been done. Again, this is a question that comes up with kids and adolescents too. You're going to dumb them down. You're going to lose IQ points. You're going to have long-term memory problems. There's a lot of studies that have really more disproved that than proved that. Okay, but those are the ones, the naysayers still like those studies that come out. Acute intoxication with THC, yes, it does affect your short-term memory. You know, while you're intoxicated, if you stay intoxicated, yeah, you're not going to function so very well. But the majority of the studies that come out is once you cease that THC stimulus, you're going to come back to essentially normal. And then on the medical end of things, we always, you know, weigh that against, okay, what are we treating? You know, you got cancer patients, you know, I'm going to sacrifice 7 IQ points for, you know, living longer, you know.
Well,
So
let's
that-
not talk about the psychoactive effects of your prescription drugs
Yeah.
that are absolutely docking IQ points. And let's talk about kids that we throw on Adderall. Let's talk about the anti-epileptic drugs that we start on infants. Those things are actually chemically altering those brains in irreversible ways. Cannabis does not cause irreversible damage to brains. It just doesn't. I mean, the most compelling studies have shown that long-term, daily, chronic, heavy users, and these are people who are quintessential potheads, who all they do day in and day out is smoke, that they have long-term memory loss and cognitive issues. But they quit for 3 to 6 months, and they get a lot of that back. Right? We can't say that for a lot of our prescription drugs that cause permanent damage.
And again, you know, we kind of try to differentiate, you know, we're talking about medical use in our clinic. We're trying to guide you how to get your optimal benefit and avoid those long-term side effects.
Right, it's all about responsible use. You don't have to use to the point of intoxication,
Right.
even if you're recreating, right? Maybe some people, listen, there are a lot of people who've traded in their wine for cannabis because it's relaxing. They're not trying to get high, they're not trying to get intoxicated. But that's a recreational purpose. You don't have to come to us, get a medical card or anything to do that. So I think it really comes down to responsible use and educating everybody, children to adults, on how to use it appropriately. And I made this sort of provocative statement that cannabis in some form or fashion should be used by everybody. Principally that CBD, right? And the whole plant, highly anti-inflammatory, highly antioxidative. When we have a population of people in the United States that's getting sicker and sicker and sicker, I can tell you we are diagnosing heart disease, high cholesterol, type 2 diabetes, fibromyalgia, and autoimmune disorders in younger and younger people. I'm talking about elementary school kids getting diagnosed with diseases of what we used to call diseases of aging. These are all inflammatory conditions, right? You know, my nephews take a little bit of CBD every single day, and that helps boost their immune system. You know, a lot fewer colds, flus. Yeah.
So again, it's a matter of balance, you know. On the recreational side, you know, you go in, they got products, okay, it's 18, 25% THC, 0.3% CBD. That's designed for the intoxicating effects of THC. You know, I would maintain that even on the recreational side, you don't really need that. You know, back in the days, you know, they got high with, you know, a 5%, you know, whole plant, you know, did fine. If you keep bombarding your brain with those really high concentrations of THC, your body's going to downregulate your endocannabinoid system. You're going to have fewer receptors. And they don't work as well. That's why people, you know, keep trying to push the dose, trying to, oh yeah, I want to get that high. Well, the best thing you can do is back off.
Stop, take a break. Yeah, I think these high THC strains that we're seeing, that's just a function of capitalistic America. You know, it's just marketing. The higher THC, the better, and that's just not the case. I do think we're going to start seeing the pendulum swing back to a healthy wellness facing industry, because most people are looking for lifestyle needs. We're actually seeing that in Washington State right now. A lot of those rec users are like, by the way, I have this, now I want to treat that. So, I don't know, I'm hopeful.
We have one more question.
Yes, what about people with Parkinson's?
What about them?
What about them? I mean, you know, if
Could they benefit?
They can benefit.
will they benefit from something like that? Because, I mean, Parkinson's goes in all different directions.
It does. Yeah, a lot of times you have tremors and muscle spasms, you know, it can be very effective for alleviating those kind of symptoms.
Balance.
You know, THC actually increases the amount of dopamine in the brain, which is one of the things we're trying to maintain in a Parkinson's patient. Yeah, I mean, yeah. So, yes.
So it would help
THC.
balance.
Yes. Yes, I mean, both CBD and THC, but we have studies that show that THC helps maintain a higher dopamine level in that brain.
It can help with balance, with the caution that too much THC, one of the untoward side effects can be dizziness and loss of balance. So again, you want to have that. You want to have that balance. You know, watch your dose. You know, and avoid the more intoxicating effects.
Yeah, and just what dose of THC is appropriate for people? Most people do well somewhere between 1 milligram and 10 milligrams, depending on how experienced you are at cannabis. So we're not talking about high doses, right? When I mentioned CBD, I said you guys can all tolerate 200 milligrams per every single kilogram of body weight that you have. That's a lot of milligrams of CBD. THC is not the same. So we're really looking at 10 milligrams or less in a 24-hour period. And most people don't need that much.
As you always say, go low and slow.
Absolutely.
Start with a low dosage and go slow.
You sure you didn't want to answer the question?
You can go for it.
Yeah, I've got time.
It's just a physical, well, kind of a frivolous question. Okay, supposing you're used to having a glass of wine, say, and you like to substitute cannabis, and you don't want to smoke, because I take it if you smoke is where you start getting the immediate effect. While if you ingest it, it would be a very different kind of high, if that's what you were looking for. Is that right? So instead of wine, what do? Have a piece of candy and then wait for 15 minutes?
Some people do.
Yeah, some people do. I mean, again, we talked a little bit about, the different means of ingestion. People smoking or vaping, the inhalation route, they like it because it's very quick and titratable. That means you know what effect you're having fairly quickly. We could still have a fairly quick effect with sublingual tinctures and things, peak blood levels with the inhalations like 5 to 10 minutes, tinctures, 20 minutes or so. True edibles, they much slower, maybe 2 hours before you, notice any effect. So you got to have some experience, before you go that route right off the bat. But those are the other means of ingestion that you don't have to smoke it. The sublingual route and so I say, when you combine them, they always warn a little bit combining alcohol with anything else, and it can make you a little more sedated, make you a little more.
They do make cannabis beverages. You wanted to switch a beverage for a beverage.
Yeah.
There is CBD beer now. There is.
Yes.
There is CBD beer now.
Leave it to Oregonians.
It's good. It's an IPA.
Gluten-free CBD.
That exists in Oregon too.
Yep, migration.
Particularly the Portland area.
What I see as incredibly inspiring, also personally very sad, because it's my wife's birthday, and she might have been alive today. I know for a fact what marijuana does for chemo reactions. Incredible. I know how the medical establishment was kind of overdosing her with every anti-nausea drug you guys know. And when she tried marijuana, she was eating again, her mood increased. It was incredible.
Yeah.
What we didn't know then is that now they're studying anti-cancer effects. And that's a sad part for me. It's inspiring, but that really needs to be funded and studied. We know it relieves a lot of quality of life issues, but the anti-cancer and the other diseases, it may actually, the C word, besides cancer, the cure word, which we were so scared of, don't say cure,
Yeah. Well, it's sad, it's frustrating, and it's infuriating. I think that's half the reason why, honestly, we do this. Like, my passion comes from the anger that I had because I wanted to become a doctor to help people heal. And that's not what my education that I paid for and I'm still paying for taught me. None of that. I think the best that I got was, I know anatomy and I know pathophysiology. All that's great, but this is nothing that I do now resembles the conventional system in hardly any way. But it is a shame. In our family, my mom's mother passed from breast cancer. Their first child died from brain injury, and had cannabis not been prohibited, maybe both of them would still be around, right? So I think we all have stories like that. An incredible disservice happened when we prohibited cannabis for very malicious.
Yeah, it's still, they're still not talking about cannabis in major areas, the opioid epidemic. I started this like 4.5 years ago, and the biggest deal, the people who get off the opiates, and all the studies have shown, cannabis is synergistic with opiates. See all these patients, they're in a pain management program, and they test positive for THC. We're cutting you off, you're out of the program. No, you got it wrong. These people use less opiates, it's more effective at a lower dose, you don't develop the tolerance to it, you don't have the overdose problem. Again, as we said, it doesn't affect your respiratory drive, and they work together much more effectively. And my opinion is that anybody who's on an opiate should be taking cannabis right along with it.
The data speaks for itself. Medicare data actually shows that in states that have legalized, there have been a 25% reduction in hospitalizations and deaths from opiate overdoses. I mean, it speaks for itself. And we also see a significant reduction in prescription drugs for anxiety, for seizures, for blood pressure, for other mental illnesses. What else?
Depression.
Yeah, oh yes, depression. A lot of mood disorders. People are coming off of their prescription drugs. This is Medicare data. We know how much money is being saved in states that offer cannabis or easy access to cannabis. But we have a long way to go. There's still inequities. We have patients that come to see us from all over the country. I think our farthest patient was a kid in France with seizures, but because we do telemedicine as well.
A guy from Australia.
Oh, really?
Yeah.
I don't even know about that one. But most recently, again, very sad story, and this was actually a grandmother of a friend of mine. They lived in Georgia, Texas, and very unfavorable laws. And she, it was a Hail Mary, and we have seen Hail Marys with cannabis. We've seen people come back from the brink of death and using cannabis, and they came out here, had her evaluated, and started using product, and her lungs cleared up. She had a lot of fluid building up on her lungs. There was nothing else that could be done with respect to chemo or radiation therapy. Their goal was absolutely to reverse that disease, and that's what their goal should have been. But she did not make it. But I got a phone call, and they wanted me to know that even though she didn't make it, the cannabis medicine helped her. She was breathing, she was speaking where she wasn't before she started using that. So they were able to talk to her, and she was able to enjoy the last moments of her life. That's why we have a lot of people, hospice workers, wanting to promote the use of cannabis in pain and comfort regimens, and I think it's highly appropriate at end of life. But we think it's highly appropriate, throughout life. We firmly believe that everybody should be taking some sort of CBD supplement on a daily basis, like you would your turmeric or any other vitamin or supplement that you take, because of its powerful anti-inflammatory properties.
Yes, we have one last question.
I have a quick question. How is the cannabis used in the rest of the world, like Europe and the rest of South America, Australia?
Yeah, much.
Canada would be fantastic.
Yeah, where it's legal, much the same as here. So GW Pharmaceuticals is a UK-based biopharmaceutical company. They have Sativex and then Epidiolex, which is finally FDA approved here. But Sativex has been approved for years, and a lot of European countries have that available to their patients. But in a lot of those countries it is. You have the option to take the pharmaceutical, or you can take the whole plant. It's variable. But then there are still countries that it's capital punishment if you get caught with cannabis. So for people who are traveling with their cannabis, don't go to the Middle East with it.
And Israel's doing a lot of research, and it's legal, and they use it in their hospitals there.
Yeah, but it's really hard for patients to get cannabis in Israel. Very interesting. And they have a lot of programs in hospital use, but it is very hard for just the patient to walk up and get approved for use.
And a lot of research.
It's very weird.
Yeah.
Well, thank you. Thank you so much for being
And I appreciate you all. If you have any questions, there are, you can email the American Cannabinolgy Clinic for any information. We've got some handouts in the back. This is Dr. David Knox's bio. I was surprised delightfully that Rachel could make it with us today. And I have an article that the Wall Street Journal had in their magazine section about a month ago about not everybody must get stoned. talks a little bit about the other properties in cannabis. The endocannabinoid system 101 that the clinic has put out. And then last but not least, I found this article on CannabisMD.com. And one of the things that I was using a lot to deal with fibromyalgia was Advil. And I was taking 16 Advil a day, and I'm lucky to have a stomach left. But I have friends that are still taking a lot of ibuprofen, and it's not very good, especially as we get older. So there's a little article about CBD versus the anti-inflammatory drugs that we all go to as we get older. All right, again, thank you very much for your time, and have a good one.